Hey guys, now today we're going to be talking about how to treat your painful periods or your dysmenorrhea. So don't go anywhere. We're going to get right into the video. See you there. Hey guys, welcome back. So, as I stated, we're going to be talking about how to treat your period pain. Now, it's important to note that you may not be able to stop period pains or menstrual pain altogether, but it's also important to note that you can reduce the pain. And one of the most important ways to reduce the pain is by prevention. Prevention is always better than the cure. So if you can prevent yourself from having a painful period next month, go ahead, have at it, because everyone wants that break. Can you imagine for your entire reproductive years, from the day you start having a period or a few months after you start having your period, you start having debilitating pain every single solitary month until you have a baby? But to culminate or to receive the ending of that pregnancy is another pain. And then a few months later, they say, okay, if you have a baby, you're not gonna be having any more pain. But guess what? It doesn't work like that for every woman. Some women, as soon as they start having their menstrual cycle again, they start having the pain. But there's a way, ladies. There's a way to reduce the amount of pain that you feel every month. And as I said, it starts with prevention. So let's talk about prevention. Firstly, you need to know how to track your period. And I already have a video that you can watch that can help you to know how to track your period. Once you know when your period is going to come, then that's when you start preparing for your period. So prevention means preparation for your period. So you're going to go to your pharmacy or wherever you can get your OTC NSAIDs. And you're going to start taking your NSAIDs at least 3 days, or your analgesics, whichever your doctor provides, or if you are safe to take over-the-counter medications, then fine. You can find your pharmacist, talk to your pharmacist, or talk to your care provider before you decide to start taking any of these medications, right? So either your doctor prescribed some pain medication for you, or you get over-the-counter NSAIDs. And NSAIDs are non-steroidal anti-inflammatory drugs that helps with inflammation and pain. Hence the name NSAIDs, right? And NSAIDs can mean ibuprofen. Ibuprofen is a very popular NSAID, or Brufen for short, and it's available almost anywhere. So you start taking your pills at least 3 days before your period starts. By taking your meds 3 days before your period starts, you're actually building up pain blocks. And when you build up these pain blocks, the pain that you feel when your period eventually starts is going to be lessened. It is also important to note that NSAIDs actually reduces the amount of prostaglandins you have in your system. And with less prostaglandins, as we know in our previous video actually, then you're going to be having less contractions with less intensity. So it's important to ensure that you start your NSAIDs before the period starts. Also, your NSAIDs help to reduce the amount of period that you have. So it might shorten and lighten your period because of the anti-inflammatory properties of your NSAID. All right? If you smoke, or if someone around you is an habitual smoker, or you work in an environment where you are forced to inhale a lot of smoking, Persons who smoke and persons who are around a lot of smoking have been said to have painful periods. So try to change your environment, or try to reduce your smoking until you can stop it, and see if that helps you to actually stop having painful periods. Now, there's not a lot of study around this, but it won't hurt by trying, right? After all, we don't want to be having painful periods for the rest of our lives, or the rest of our reproductive life, to be more correct. Studies have shown that exercise actually helps to reduce the amount of pain you have when you're having your menstrual period, right? So if you practice yoga or stretching or even aerobic exercises, those can help to reduce the intensity of the contractions that you feel whenever you're having your menstrual period. So try to do some meditating yoga, some stretches or exercises around the time that your period is coming, or a few days before your period, and continue throughout the first few days of your period where the pain is more severe, and see if that works for you. This is a little bit unorthodox, not practiced by everyone, but it's out there. Now, persons have been practicing having sexual intercourse during their period, and they say that having an orgasm and sexual intercourse would help them to relax during their period, actually help to reduce the amount of pain they experience when they're having their period. So this may not be for you, so if it's not for you, don't try. But for persons who are willing to go out on a limb and try it, have at it. It works for you, why not? If you have endometriosis, treat it. Get it sorted out, because endometriosis cannot be cured, it can be treated. And with treatment, that can help to reduce the pain that you're feeling. So speak to your healthcare provider and ensure that you find out if you do indeed have endometriosis, or if you're aware that you have endometriosis. Get it sorted out by getting treated, and then that may be able to reduce your menstrual pains. All right, ladies? Now, if you have pelvic inflammatory disease, then you may have painful periods, right? Now, if you have PID, just get it treated. It is treated with antibiotics, a course of antibiotics treated, and then it may reduce the pain that you have. But please bear in mind that even after treatment, you may still have scar tissues present, and that scar tissue can also cause infertility for some women. All right, so if you have PID, get it treated promptly, not only to reduce your menstrual pain, but to also reduce the scarring and inflammation that takes place with that condition. All right, ladies? Last but definitely not least, you have a lot of women who really don't know why they're having painful periods. They have none of the conditions that are stated above, or none of the problems that I stated above. They just have painful periods. So for those persons, you can use your warm water bath. Your warm water bath can be used with any of the conditions above. Discuss it with your OBGYN. But you can go ahead and freely use your warm water bath unless it's contraindicated for any reason. Another thing you can use is warm compress. So warm compress is just a hot water bottle or a hot water bag, and you place it on your lower abdomen or your pelvic area. Now, when you do this, it increases the blood supply, and it also helps to reduce the contraction or the intensity of the contractions that you're having by relaxing the muscles of your uterus. Now, that's very effective. It has been proven effective for many years and for many women. So for persons who are suffering from painful periods, you can also try and get a hot water bottle or hot water bag and keep it for whenever your period is coming around. And as soon as you start feeling a little pain, you start applying your hot water bottle. If you suffer from severe painful periods, right, you can do your hot water compress and take your NSAIDs. Remember, the NSAIDs help to reduce the amount of bleeding that you have. It also helps to reduce the prostaglandin in your system, and it also helps with the pain because it also helps to stop pain. The warm compress helps to relax the uterine muscle and also helps to increase blood flow. So both of them together should help to reduce the amount of pain that you have when you're having your menstrual period. So talk to your OBGYN, find out if you have any contraindications to using any of these methods to help to reduce your pain, or you can talk to your care provider if you do not have an OBGYN and get yourself sorted out. It is time we take back ourselves from all of these things that are on us, painful periods, when we can have simple things or do simple things to reduce the amount of pain that we have, to make it a little bit more manageable. For some women, they have mild pain whenever they're having their period. And mild pain when you're having your period is acceptable because, of course, you're having contractions. But for many women, either their pain threshold is very low or they have severe periods because of high levels of prostaglandin in the blood, and that can cause increase in the intensity of the contractions that you have whenever you're having your period. So don't be held hostage by your menstrual period. Get yourself sorted out today. There's simple things that you can do at home, as we said, and there's simple medications that you can get over the counter. But with all of that, prevention and preparation is the best medicine yet. All right, ladies? Don't forget to like, subscribe, and share my videos. If you haven't liked us yet, if you haven't subscribed as yet, click on the subscription button. Click on the notification bell. Press all so that you can be informed whenever I post a new video. I'm looking forward to see you returning. And to my subscribers, I thank you very much for subscribing and sticking and staying with me. I look forward to talking to you again. And remember, if you have any questions, just sound off in the comment section and I'll be sure to answer you. Have a wonderful day, everyone.